Back Monday is World Osteoporosis Day. It's a condition that affects millions of Canadians, often without them even realizing it.
In fact, it is called the silent disease because you can't feel it until a fracture actually happens. But 1 in 3 women and 1 in 5 men will have an osteoporotic fracture in their lifetime. So here to tell us more about osteoporosis and how to prevent it is Dr. Sheila Wijayasinghe. Welcome back, Dr. Sheila.
Always good to have you here, Dr. Sheila. All right, so just break down for us, what is osteoporosis and how serious is it?
So it's a very serious condition of the bone where the bone density can decrease over time and it becomes thin and weak and can fracture easily. And it's so important because osteoporosis actually means porous. So we think about our bone matrix, it starts to stretch out a little bit and become thinner. We don't feel it, like you said, it's a silent disease, but we may notice it, like our posture can change, our height decreases, but most importantly, a fracture can happen, which can cause a loss of independence, pain, and early death. We know that 1 in 5 women who have a fracture related to osteoporosis will die within that next year. 1 in 3 men will die after having an osteoporotic fracture within that year. So it's so important that we talk about it because we can prevent this from happening.
Wow. All right, so there are different types of fractures, right? So which ones are the one that we should be concerned about when it comes to osteoporosis?
That's a great question. So like traumatic fractures are the ones that we know with sports injuries or car accidents, but then there's something called a fragility fracture. And that is a type of fracture that happens with very low impact. So you step off a curb and you break your ankle, or you fall from standing and you break a wrist. And that's actually really common, but we undertreat it. If you are over 40 and you have a fragility fracture, that is basically a signal that you likely have bone density changes and should be further investigated. But less than 10% of people who have that kind of fracture actually go on to get that sort of extra investigation done. So there's a huge care gap. So if you've had that happen in your life, please do get checked out because we should be investigating as to why.
Wow.
Now, I've also heard that menopause has a big impact on bone health. Why is that?
So really important, menopause, so estrogen is the main hormone that we talk about when it comes to menopause. And in menopause, our estrogen levels decline very quickly. And estrogen is like the bodyguard of the bones. It prevents bone loss. And so when we don't have estrogen, because our estrogen levels drop in menopause, we don't have that bodyguard anymore. And we lose about 20% of our bone density in the first 5 to 7 years of going through menopause, which is why we see women start to fracture in their 50s. And that's why it's so important to consider things like menopause hormone therapy to prevent that from happening.
So who is most at risk of getting osteoporosis?
Yeah, so this is a really important list to know and keep in your back pocket, because if we know what our risks are, we can then prevent things, right? So we know that if you have a family history of osteoporosis, specifically if you had a parent who had a hip fracture, that can put you at an incredibly high risk of having osteoporosis yourself. Low body weight, because a low BMI, you're not putting pressure on your bones, and so that can decrease your bone density. If you smoke or use alcohol, that can also decrease your bone density, along with heavy caffeine use. Steroid use. So we think about people who have inflammatory conditions or autoimmune conditions. Steroids decrease your bone density. So if you have been taking steroids for any of those conditions, you may be at higher risk and should be tested early as well. And any state that you may not be getting enough calcium or vitamin D in your diet, and certainly in Canada, we don't have enough vitamin D because we don't get enough sun, we are at risk of this as well.
Okay, so how do you test and see the state of your bones?
Yeah, so there's a simple test called the DEXA scan. It is an X-ray test that we do. It's a low-dose X-ray scan. It takes your hip and your back, and then it can predict, do you have a low, moderate, or a high risk of having a fracture. It is covered for everybody in Canada over the age of 65, but it will be covered if you have any of those extra risk factors and your doctor deems it that you need to actually have that extra test. What's really important is that men are left out of this conversation so often because we see this as a women's disease, but men get tested less than their female counterparts, and we really need to emphasize that they should be having this test as well.
Okay, that's good to know.
Yeah. So how can we? Sorry.
Oh, blood work. Yes. Is there a blood test? Is there blood work we can do?
There isn't. We don't routinely need to do blood work, but if there's a cause of osteoporosis, so if you're having that fracture at 40 that we don't know why that happened, we should look for secondary causes, meaning that there's another reason why you're having this bone density change. So is your thyroid off? Do you have low vitamin D? Is your calcium off? Are you not absorbing things well in your diet? And that's a reason that we would do blood work, but we don't routinely do it.
Okay.
All right, so how can we prevent bone loss before there's an actual problem?
So this is where it comes down to what I love talking about is prevention. And prevention is so key around preventing osteoporosis. Thinking about things like calcium and vitamin D. These are essential. These are the building blocks of your bones. And so osteoporosis.ca is a great website I refer to. You can go on, see what has good calcium. We try to get your calcium in your diet first before going to supplements. So if you have milk or fortified beverages that have calcium, if you have salmon or some sort of like fish that has bones, that can be a great great way of getting calcium. And then if you want to get your daily requirement, you can top it up with a supplement if you're not reaching it. Vitamin D in Canada, again, we don't test vitamin D routinely because we assume everybody is deficient in Canada. So just taking a supplement once a day is very helpful. The other things are protein, exercise. Those things put stress on your bones and help them increase their density, and avoiding things like the smoking and alcohol.
Okay. So if someone already has osteoporosis, is it reversible?
So it's not reversible necessarily, but it's very treatable. So we try to prevent further bone loss is what our goal of treatment. And if you are at that point, we do the lifestyle measures, but then we also can add medication. And so there's different medications. There's oral medications, there's injectable medications, and there's also menopause hormone therapy that can be used as prevention.
So we also hear about osteoarthritis. So what is the difference between that and osteoporosis?
So osteoporosis is a disease of the bones themselves, and osteoarthritis, arth means joint, so the space between the bones, is a disease of the joint spaces. So inflammation of the joint spaces is arthritis. They're different because arthritis hurts and it causes pain, whereas osteoporosis does not cause pain unless you have a fracture. They sound very similar though, so they're confusing, and they can happen at the same time.
Well, this conversation has been so informative, but if somebody wants more information, where should they go?
So osteoporosis.ca is an excellent resource. It has a calcium calculator on there. You can figure out what your risks are and take that proactive step. And there's also a risk calculator you can do called the FRAX score. I do it in the office with my patients, but you can also do it for yourself. You put in all your numbers, your history, your family history, and it'll give you a score. And that may trigger then us to say, you need to have an earlier test done. And it can make a huge difference because osteoporosis is a disease that causes a loss of independence, and we can prevent that from happening.
We love this information, and you're the best person to deliver it, Dr. Sheila. Thank you. Thank you. So good.
Hey, you, come a bit closer. We've got so many more must-see interviews, spicy debates, lifestyle tips, and pop culture moments. So subscribe to our channel by tapping the logo below and don't miss out.